Are you considering stem cell treatment? And if so, what is the best way to prepare for that stem cell treatment? Got a problem with your knee? This is Dr. P, otherwise known as Dr. Mark Petropoli. First, I must say with regard to stem cells, we don't really have true stem cell injections in the United States. We're not allowed to culture cells. We're not allowed to mail them out to a lab and send them back and inject them back into a patient. I cover that in many of our other videos. If you want to watch those videos right down here, just click on any of those links. So we don't truly have stem cell injections, but we do have injections where we harness the healing properties of your body. PRP, Platelet Rich Plasma, basically takes the platelets from your blood. We concentrate the blood, get the platelets out. The platelets have growth factors. Those growth factors help stimulate new blood vessels and cells to come in the area to help heal. Similarly, we are able to harvest cells. I usually utilize bone marrow cells. You can also take adipose or fat cells, and you can harvest them in a way to concentrate them, to inject them back into the body to help the cells do the work and help heal your body. So bone marrow does have stem cells, and it has other cells that help the stem cells, but it's not truly stem cell injections where we're culturing the stem cells. That's not allowed in the United States. Having said that, when you're going to prepare for these type of injections, any type of biologic treatment, it's really important to be well prepared. So I would say the first thing is drink a lot of fluids, be hydrated. Number one, that just helps flush out all the toxins, okay? Also, your cells love to be hydrated. They function better when you're not dehydrated. Thirdly, when the patient comes in and we're going to do a blood draw to take some blood to spin it down and get the platelets out, or we're going to take some bone marrow. Bone marrow is a thicker liquid, but it's still a liquid. The more hydrated the patient is, the easier the procedure goes and the better quality material that we get. So it makes the procedure go a lot easier, and then it also has good health benefits for yourself. Another thing is medications. When we are going to be performing a biologic procedure on a patient, we go through their entire list of medications. There are certain medications that would adversely affect or counteract a biologic treatment. Things like anti-immunologic medications, things that are taken for autoimmune diseases like rheumatoid arthritis, lupus, etc. There are many medications that block the immune system in patients who have rheumatoid arthritis and lupus and autoimmune diseases, and those can adversely affect the healing properties of any biologic procedure that's performed. Because when we're doing those procedures, we actually want to restart the healing process. And medications like prednisone or methotrexate, they can actually slow down the healing process. So we want to talk to the patient's physician who has them on that medication and see if they can come off those medications. Typically, if someone is on something like prednisone or methotrexate or some other anti-biologic medication, typically we would like them off of it for 2 weeks before the procedure and at least 2 weeks after, ideally even longer. And if they can tolerate that, that's great. Some patients can't tolerate that, or their physician won't let them come off it, then they might not be a candidate. So all medications should be discussed. Those are just a small sample of some of the medications that can have adverse effects on these treatments. The other big category of medications that can have adverse effects is non-steroidal anti-inflammatories, NSAIDs. So things like aspirin, ibuprofen, Aleve, they have negative effects on platelets, and PRP stands for Platelet Rich Plasma. So we don't want to do anything that's going to adversely affect how our platelets function and work. We want them optimized at the time of the injection. So usually, similarly, we want people off any anti-inflammatories for usually approximately 2 weeks before and 2 to 6 weeks after. There are certain patients who need to go on them because they just can't survive all the other joint pain and all the other aches and pains that they may have that those anti-inflammatories are helping. But when we do a biologic procedure, we're actually restarting the healing process, and that requires inflammation in the beginning. So we actually want inflammation. That's how healing first starts. So that's why we don't want people on anti-inflammatories. Another thing is diet. Things that can adversely affect these injections are things like too much caffeine, Alcohol is a poison, so that can cause harm to cells, especially cells we're taking from one area and putting them into another area. People have also found, and studies have shown, that the more vegetables, vegan or a plant-based diet will actually produce better platelets, and there'll be more anti-inflammatories. You do, if you can, want to avoid pesticides. So theoretically, organic fruits and vegetables would have less pesticides on them. Pesticides can cause damage to cells, and we certainly don't want that. So diet is a huge one. Not smoking. Smoking, not only does it have poisons in it, but it also has nicotine. Nicotine will constrict blood vessels, and we need blood flow to areas to bring in oxygen, nutrients, and also take out all the toxins and the bad stuff. So if we constrict blood flow to an area, it's going to not heal as well. So smoking is another really bad thing. Diabetes, want to make sure that diabetes is under control. The hemoglobin A1C is basically a measure of how a person's glucose has been over the course of 3 months, not a day-to-day thing like your normal glucose. So if it is 7 or greater, we usually won't perform the procedure because there's a much higher risk of infection or complication or not a good result. So diabetics in general have a little higher rate of infection, complications, wound healing problems. But if the hemoglobin A1C is over 7, we usually won't perform the procedure or even surgery. Another thing that people don't realize can really help their stem cells in their bone marrow is exercise. Weight-bearing exercise stimulates your bones. Our bones are where our bone marrow is, inside the bones, and that's where the stem cells and the other cells that help the stem cells reside. So the healthier your bones are, the better your bone marrow is going to be, and the better the cells are going to be. So exercise not only helps build bone, and the more bone you have there, the more the cells can stick to it, but also it builds stronger bone and healthier bone, and it allows for more blood flow to that bone. And so when we take the bone marrow, it's going to be better conditioned than if you had osteoporosis or some other bone disease. So exercise not only improves blood flow to the bone, which helps the cells grow better in there. Exercise can also strengthen your bones, and if your bones are stronger, they're going to have better cells in them. They're going to be healthier. So exercise can really actually help with your preparation for stem cell injections or bone marrow injections as well. One final thing to consider is supplements. A lot of people take supplements and then they don't tell their doctor about them because, oh, they're not a medication or they're not prescribed. But there are a lot of supplements like turmeric, which are an anti-inflammatory or have anti-inflammatory properties, and those we do not want you taking after the biologic injections, because again, in the beginning we want some inflammation. That's the early start of the healing process. So there are certain supplements that can inhibit these biologic injections that we do. So always give a full list of your supplements and any medications that you're taking to your doctor who's going to be performing the procedure. So as you can see, it seems complicated, but it's really not that complicated. There are certain things that a reputable doctor like myself, my clinic, will have for you, and we'll go through these and we'll help you beforehand. Hey, are you taking this? Are you taking that? What supplements we're taking? You know, make sure you drink 8 cups of water the day of, a few days before, things like that. So we'll go over that type of stuff. And also you can watch this video and review it, but it's not as complicated as it sounds. It's basically common sense, healthy eating, healthy living, don't smoke, don't drink too much caffeine, exercise, proper diet, lots of fruits and vegetables, okay? That's the simplest thing. And always tell your doctors what medications and what supplements you're on. Stay hydrated. And if you got a problem with your knee, this is Dr. P. Give us a call.